All right, welcome to The Explainer. Today we're diving headfirst into a high-stakes medical emergency where every single second is critical. We're going to break down the telltale signs of a major stroke and talk about a super simple tool that can literally make a life-or-death difference. Okay, so picture this. A high-stakes medical emergency is unfolding right now. Paramedics are on the scene and they find a patient with some really sudden, alarming symptoms. Their job, they've got to piece together the clues, and they've got to do it like yesterday. And this is the question at the heart of it all. Imagine a 66-year-old man. One second he's fine, the next his whole world is just turned completely upside down. He can't get words out and half of his body is just not responding. The clock is ticking, and the very first step is to figure out what on earth is happening inside his brain. So, let's break down the clues we're working with. First, there's acute aphasia. That's the sudden inability to speak. Then you see a facial droop and total paralysis down his left side. And then, and this is a big one, there's this last, very specific clue, neglect. He's basically ignoring the entire left side of his body, almost like it's not even there. You know, these aren't just random symptoms. They're all pieces of a puzzle, and they're all pointing to something really specific and really, really big.
Yeah, all of those signs are screaming that this is a major event. We're talking about a blockage in one of the brain's most critical supply lines.
And here it is, our prime suspect, a large vessel occlusive stroke, or what doctors call an LVO. Now, this is a kind of ischemic stroke. That just means it's caused by a clot. But an LVO? Oh, that's the big one. That's where the blockage happens in one of the main arteries of the brain.
Here's a good way to think about it. Imagine the brain's blood supply is like a massive road system. An LVO isn't just some little side street getting blocked. No, this is like a complete shutdown on a major 6-lane highway. When that happens, everything downstream just grinds to a total halt. And these are the exact highways we're talking about. You've got arteries like the basilar, the internal carotid, and the middle cerebral artery. I mean, these are the absolute superhighways delivering that precious oxygen-rich blood to huge chunks of the brain. So, what happens when those massive areas are starved of oxygen? Well, you get a catastrophic disruption of all those complex, higher-order functions. We're talking about things like speech, being able to process what you see, controlling your arms and legs. This is exactly what's happening to our patient right now.
Okay, so you're a first responder, you're faced with this absolute catastrophe. How in the world can you quickly and confidently say, yep, this looks like a major LVO stroke? Well, you need a tool for that.
And this right here is such a critical question, because getting that diagnosis right out in the field, it changes everything. It determines which hospital the patient goes to, what kind of treatment they get. A fast, accurate assessment is literally everything.
And that amazing tool is called the VAN assessment. It's a simple, powerful screening method designed for exactly this kind of situation. So let's break down what VAN actually stands for.
All right, first up, the V stands for vision. So the paramedic would check if the patient's having any kind of visual disturbance. You know, can they not see on one side? Are they seeing double?
Next up, A is for aphasia. And we already know our patient has this. He can't speak. So right there, that checks a huge box for an LVO stroke. And finally, we have N for neglect. Remember how our patient is totally ignoring the left side of his body? Well, that is another massive red flag, and it checks the final box in our VAN assessment.
Okay, so here's where it all comes together. The formula is actually super simple. If the patient has weakness or paralysis on one side and they have any one of those VAN symptoms, so vision problems, aphasia, or neglect, then you've got to strongly suspect a large vessel occlusion. Our patient, he's got paralysis, aphasia, and neglect. It's about as clear-cut as it gets.
But wait, being a good medical detective isn't just about finding evidence for your theory, right? It's also about ruling out the other possibilities.
So let's see what else we can rule out. Take a hemorrhagic stroke, for instance. That's when there's bleeding in the brain. That usually comes with signs of pressure building up in the skull. We're talking sky-high blood pressure or a really slow pulse. Our patient's vitals? They just don't fit that picture at all.
Okay, so what about a TIA? You might have heard it called a mini stroke. Well, the key word in transient ischemic attack is transient. It means the symptoms show up, but then they go away. In our patient's case, the symptoms are incredibly severe and they are definitely not getting any better. So a TIA? Yeah, highly unlikely.
So there we have it. We've pretty much solved the puzzle. All the clues are pointing in one direction. a large vessel occlusive stroke. But understanding why identifying this is so important, well, that's the final and most critical piece of it all.
And this right here is the ultimate takeaway. Using a simple tool like VAN to quickly spot a major LVO stroke means that that patient can be rushed to a specialized hospital, one that can actually perform the advanced procedures needed to get that clot out. I mean, it is a race against the clock, and every single minute you save is brain tissue you save.
Knowing the difference between some minor event and a truly catastrophic blockage like this, and being able to recognize those key clues like vision loss, aphasia, and neglect, that knowledge can literally change a person's life. So the question I want to leave you with is this. After walking through this case, do you think you could spot the science?